we can start the session.
Good evening, everyone. Myself, Dr. Meet Desai, Master in Veterinary Surgery and Radiology. Currently, I'm working at the VSPC, Vadodara, Gujarat. Today's topic on the shedding lights on the dry eye insights with Dr. Narendra Chauhan, sir. Today, we gather for a new webinar series on veterinary ophthalmology branch, which initiative by Entomeet Pharmaceutical. For that, I request to our speaker, Dr. Falguni Gupta, who is pursuing her master in animal reproductive gynecology and obstetrics at Mumbai Veterinary College. So please, Doctor, continue from this.
Good evening, everybody, and welcome to today's online meeting on dry eye insights. I would like to introduce today's speaker, Dr. Narendra Chauhan. He is a director of Myra Pet Clinic and Surgical Center in Indore. He has completed his BVSc from College of Veterinary Science and AH in Mahua, MP. He's done his MBSc from Veterinary Surgery and Radiology in 2005, again from College of Veterinary Science and AH in Mahua, MP. He is involved in veterinary ophthalmological clinical practice since 2011. He has traveled to USA, Germany, China, Singapore, France, Portugal, Italy, and many other parts of the world to learn ophthalmology. He has more than 19 years of experience of general surgery, including soft tissue surgery, orthopedic surgery, oncological surgery. He has worked as a veterinary surgeon in government veterinary hospitals since 2005 till 2018. He's heading the only center of veterinary ophthalmology in central India, where they do all the medical and surgical treatment for eyes of dogs and cats, including phacoemulsification surgery for cataract. And they have two state-of-art clinics in Indore with all the latest facilities at both the clinics. He has attended more than 100 conferences and workshops in India and abroad. He has organized and attended more than 50 ophthalmological camps. He has delivered lectures, webinars, and hands-on training on ophthalmology all over India since last 6 years. He's also been doing ophthalmic surgeries in India at different clinics and going to neighboring countries for surgeries and conducting cataract surgery courses at clinic since last 2 years. And he has trained many doctors of India, Mauritius, Malaysia, Philippines, Bangladesh, Nepal, and Sri Lanka. He has employed many doctors at his clinic and has trained them for clinical practices. He's the only doctor from India as a member of Indian Society of Veterinary Ophthalmology and also a member of Indian Society of Veterinary Ophthalmology, Asian Society of Veterinary Ophthalmology. He has received first rank in Madhya Pradesh PSC exam 2005. He's gotten Best Surgeon Award by Madhya Pradesh government in 2011. He has received Best Veterinarian Award by Red FM for 2 consecutive years in year 2022 and 23. He has received award for Best Alumni Award by Nanaji Deshmukh Veterinary University in 2022. He has life memberships of International Society of Veterinary Ophthalmology, Asian Society of Veterinary Ophthalmology, Indian Society of Veterinary Surgeon, Indian Society of Dermatology, and Indian Association for Advancement of Veterinary Research. He is a Vice President of Small Animal Practitioner Association of Madhya Pradesh, and he is the Secretary of Indian Association of Dermatology of the MP chapter. I would like to introduce the panelist for today, Dr. Nilesh Dugli. He's a renowned veterinary expert with impressive background. He has completed MVSc and PhD in 2012. He has 25 plus years of experience in the field. He is currently serving as in charge of the teaching veterinary clinical complex at Goregaon and assistant professor of ARGO at Mumbai Veterinary College. He has published 34 research papers, guided 5 PG students, and co-guided 25 PG students. Co-principal is a co-principal investigator of 4 research projects worth 1.8 crores. He has small animal practice expertise in animal surgery, medicine, and diagnostic imaging. He is proficient in handling complex cases involving dogs, cats, and other small animals. He provides consultation services for small animal hospitals and clinics and conducts workshops and training programs for veterinarians and veterinary students on small animal practice. I would like to introduce our another panelist, Dr. Madhura Kulkarni. She has completed MBSc and PhD in 2018 in veterinary surgery and radiology. She holds experience of 10 years in the field. She is currently heading 3 clinics in Mumbai. Namely, she is director and proprietor at Shivaji Park Animal Clinic. She is a founder and director at Vet 7 Ophthalmo. She is founder and director at Uptown Vets Multispecialty Clinic. She was a research senior fellow at Anand Veterinary College with project based on progressive retinal atrophy in dogs. She has expertise in small animal surgery and medicine and specializes in ophthalmic and orthopedic surgeries. I would now like to hand over the virtual panel to our esteemed speaker for today, Dr. Narendra Chauhan.
Thank you very much, Dr. Falguni, for the nice introduction and a very long introduction also. Thank you very much, Madhura, for joining us. Thank you very much, Dr. Nitesh, for joining us, and others who have taken time from schedule and came here to learn a few things about the veterinary ophthalmology. And I would also like to thank Entomeet Pharmaceutical Company for asking me to share my knowledge on the veterinary ophthalmology. And today, basically, we'll be talking about on the dry eye. Dry eye is something which is very common in dogs, and we'll talk a few things on the dry eye. And I would like to share my experiences with you on the dry eye. So what is dry eye? Dry eye is basically a progressive inflammatory condition of the cornea and the conjunctiva caused by a lack of tears. And basically, our cornea and conjunctiva is covered by the tears. And whenever there is a deficiency in the tears, then we get this condition. It is very common in dogs, not so common in cats, but still we see cases of KCS in cats. Generally, it is a bilateral condition, and we see more this type of condition in females than in males. And in a research conducted by few doctors, it was concluded that this hormone has definite some influence on the tear formation in dogs and cats. And generally, we get a lot number of cases in our clinics. Like suppose if we are seeing 100 cases in a day or 100 cases in a week, almost like 10% cases would be of the dry eye. So it is a very underdiagnosed condition, and it's a very simple condition. Like with the few symptoms, with the few medicines, we can treat it. If we treat it very early in the disease course, then we can treat it very successfully, and we can prevent the dogs and cats from the blindness. And generally, what I have seen that few breeds are very prone for this kind of condition, especially the dogs which we see pugs are very common in our country, and other brachycephalic dogs like Shih Tzu. And this type of breeds are very prone for this kind of condition, KCS. So we'll talk about a little bit on KCS today. Let's see how it goes. So basically, when we talk about the KCS, as I told you that it is because of the lake of tears. So when we talk about the lake of tears, we first must know what is the normal tear layers in dogs and cats. So this is the normal structure of a tear film in dogs and cats. Basically, it is a three-layered structure. Here you can see a very thin structure, which we cannot just see just by the naked eye, or it is very difficult to visualize with the help of some, still with the help of some magnification. It's very difficult to appreciate it. So basically, it is a three-layered structure. First one, or the outermost layer, is the lipid layer. The middle layer is the aqueous layer, and the innermost layer, which is facing the cornea, is the mucus layer. And the overall thickness of this tear film is around like 7 to 9 micron in most of the animals. And out of this, just zero point 0.1 to 0.1 micron, zero point 0.1 to 0.2 micron is your lipid layer. Almost 90 to 95% of the layer is the aqueous layer, and zero point 0.1 to 0.2 micron is the mucus layer. And mucus layer is facing the cornea, and your lipid layer is facing the environment. What is the function of this tear film? That is very important to know, because cornea is a avascular structure, and for the nutritional requirement, for all the requirement, for oxygen requirement, for electrolyte requirement, this cornea is dependent on the tear film. This tear film is responsible for the oxygen supply to the cornea. All the electrolytes cornea gets from this tear film. All the antibacterial substances, some growth factors, electrolytes, everything comes from this tear film. So the health of this tear film is very important for a healthy cornea and conjunctiva. So there are few, here you see, these are the different layers of tear film. This is your lipid layer, outermost layer, aqueous layer, the middle layer, or the innermost layer is the mucin layer. And there are different glands which make this layer. Here you can see, this is your lacrimal gland, this is your third eyelid gland or nictitating glands. Here you see the meibomian glands and the conjunctival goblet cells. So your aqueous part of your tear film is made by this lacrimal gland and the gland of the third eyelid or the nictitating glands. The lipid layer is made from this meibomian gland, and your missing part is made from this conjunctival goblet cells. If in any of this gland are affected by any disease, then there will be problems in your tear film. And whenever there is problem in the tear film, then we will have problem in the cornea and the conjunctiva. So these are the gland. Basically, why I'm showing this picture, because these two gland are mainly responsible for almost 90% production of the tear film. That is the aqueous part. From these two gland, your aqueous part of tear film is produced. This is your lacrimal, the gland of the third eyelid. And this is the parasympathetic supply to the lacrimal gland and the gland of the third eyelid, which is also very important, because if the parasympathetic supply is compromised in few patients, then also we face the dry eye condition. So before going for it, now we know that what is dry eye and how the dry eye occurs. Whenever there is any problem in the tears, then this problem happens. But what are the different causes for it? There are many causes, like it can be drug induced, it can be surgical induced, it can be immune mediated, it can be idiopathic, it may be because of some orbital or supraorbital trauma, and it can be infectious or congenital disease. When we talk about the drug-induced KCS, it is also very common in dogs and cats. When atropine is the drug we generally give in most of the animals when the animal is having some ophthalmic condition, especially the corneal ulceration. In cases of corneal ulceration, we use atropine drops very frequently, and generally these drops can cause deficient lacrimal gland function, and ultimately may lead to dry eye. Anesthesia, like if we are giving general anesthesia to the animal, it may cause transient decrease in the tear secretions, and it may lead to transient KCS. Few sulfonamide drugs can also, reduce the production of the tears, and sometimes it can transiently or sometimes permanently develop KCS in dogs. Few drugs such as timolol, which we use frequently in our practice, it has been reported that this timolol drug cause KCS in humans, but it is not so in cases of dogs. But we need to find out if it's causing problem in humans. It can cause problem in dogs also. But the research is going on, but nothing concrete as such. Few other drugs also cause KCS in dogs and cats. Second cause is the removal of the third eyelid gland. Cherry eye is a very common condition, and this type of problem is frequently presented in our clinic. But what actually happens, sometimes the doctors basically cut this gland rather than repositioning it, and this gland is responsible for almost 40% production of the aqueous part of the tear film. If we cut this gland, then almost 40% production of the aqueous part of tear film goes away, and with this the problem of KCS rises. But the thing is that generally we do not see the effect of this cases immediately. Like it takes around like 4 to 5 years to see that just because of the lack of this gland or just because of the excision of this gland, the KCS has developed. So we should not be cutting this third eyelid gland. We should always be repositioning it, and that too as early as possible. And immune-mediated disease is the most common KCS in dogs and cats. And the exact mechanism is not too sure how actually it happens, but it is one of the most common form of KCS. And generally, we see most of this case either, I mean, they are immune-mediated or they are idiopathic. That makes the largest KCS cases. So orbital and supraorbital trauma is very common in dogs and cats, and whenever trauma occurs to dogs and cats, just the eyes popped out from their normal position, and when the eyes pop out, it can cause damage to the nerves, and whenever there is damage to the nerve, ultimately it may cause the dry eye. Infectious causes. When we talk about the dogs, not many infectious condition causes the dry. The first condition that causes dry in dogs is distemper. Distemper is very common, especially in the small puppy, and it causes dry eye. Leishmania is one more condition. And when we talk about the cats, herpes virus and the chlamydia, these two are the condition which causes dry eye in cats. And when we talk about the infectious causes, and again when we talk about the dogs and cats, in dogs, mainly it is the non-infectious causes which causes the dry eye. And in cases of cats, it is mostly the infectious causes which causes the dry eye. So whenever you're treating dog or cat, you have to keep in mind that in dogs, mostly it is the non-infectious causes, and in cats, mostly it is the infectious causes. Congenital cases is also very common. Personally, though I haven't seen any case of congenital cases in my practice, but it has been given in the literature, and the science began as early as 10 days of age, and often it starts with the corneal ulceration and the severe dryness. After the immune-mediated cases, the second most common form is the neurogenic cases. Whenever there is, facial nerve palsy, or there is some problem with the parasympathetic supply to the lacrimal gland or to the lacrimal nerve, then it will lead to neurogenic cases. This type of cases is also common, and dysautonomia, generalized lack of sympathetic and parasympathetic innervation in the cats uh, has been described as cause of cases in cats. So what are the clinical signs in KCS? Now we know what is KCS. Basically, it is the inflammation of the cornea and conjunctiva and caused by the lack of tears. We know what are the different layers of tear film. Now we also know what are the different causes of dry eye. Now we'll talk about the clinical signs. There are only few clinical signs which we see in the dry eye. First is the pain when it is an acute clinical condition, pain and blepharospasm. Then there will be mucopurulent discharge. Then there will be keratitis, and then there will be conjunctivitis. So these 3 or 4 signs are very common in cases of dry eye. Here you can see in this picture on the left side, mucopurulent discharge is there, a mild hyperemia is there, and your cornea is also little dull, not very shiny. In the picture, in the right side, you can see a lot of mucopurulent discharge, hyperemia is there. And if you look very closely, you can see the blood vessels also. So whenever you see the blood vessels or the pigmentation on the cornea, then you know it, you are dealing a chronic case of KCS. It is not acute case. So I'll show you a few more pictures of the cases. Here again, you can see mucopurulent discharge, little hyperemia. Here you can see mild discharge, but here you can see the pigmentation, opacity on the cornea, and your cornea is not very transparent. Again, few more pictures. Again, you can see the hyperemia, mucopurulent discharge. Your cornea is not as transparent as it should be, right? Here, your cornea is not at all transparent. It is very hazy, and ulceration is also there here on this corneal surface. And of course, the mucopurulent discharge or mild discharge is there. Again, a typical case of bug. I mean, you must have seen this type of cases in your clinic, and whenever you see this type of case, the first thing that should come to your mind is the KCS or any chronic irritation, right? And here you can see a lot of mucopurulent discharge, lot of pigmentation. You cannot appreciate the cornea. You are not able to see through it. So cornea is highly compromised. And again, in the second picture, you can see uh, mucopurulent discharge is there and a mild ulceration is also there, right? And again, in this picture, you can see your cornea is very dull, not so shining. A normal cornea should be very shining, bright, and it should be transparent. But here you see your cornea is not transparent, it's little dull, and the ulceration is also there. And again, you can see mucopurulent discharge is there. Again, in the second picture, you can see this mucopurulent discharge cornea is not very transparent, little sign of hyperemia and mucopurulent discharge. Again, sometimes the dryness can cause ulceration. Here you can see few, and the cornea is also pigmented. And the other picture you can see mucopurulent discharge is there, and the cornea is not very transparent, little opacity is there, pigmentation is also there. So these are the clinical signs in the dogs and cats. Mainly it is dogs, not so in cats. I'll show you a few more pictures in cats later on. And here you see the cornea is completely pigmented in both the pictures. Your cornea is pigmented, animal is not able to see just because it is a very chronic case, and generally in chronic cases pigmentation develop, and it is very common in cases of brachycephalic breeds. So, and when the pigmentation develop, your animal is blind, and these type of cases are a little difficult to handle, especially when your patient is blind, not able to see, a lot of pigmentation is there. Because no medicine works on this, you have to do the surgery only. That is the only option to treat such cases. and a typical presentation of a pug. You can see both eyes fully pigmented. You cannot see even a small part of non-transparent cornea. Cornea is completely pigmented. Now you see a very bad case of a pug. The cornea is completely got damaged, and very less can be done into this eye. But these are the clinical pictures of the cases. You must have seen this type of pictures in your clinic. So whenever you see this type of picture in your clinic, you know it that you are dealing with the dry eye or keratoconjunctivitis sicca. So you have to treat it accordingly. And sometimes whenever you see cases of recurrent ulceration, whenever you give medicine, it heals, but again it reoccurs. Then you should think of the keratoconjunctivitis sicca in your practice. Again, a very bad case of dry eye and completely damaged eye. Obviously, I don't want to see such type of cases in my practice, and we should handle such type of cases as early as possible so that you can save the eye of the animal and they can see through it and they can see completely. So now we know that what is cases, what are the clinical signs, but how to diagnose it, right? So we have a very simple test available with us, and through this test we can. I'm sorry, I think there's some problem with my presentation. Sorry. So, how to diagnose a dry eye condition? Basically, we have a very simple test. Shimmer tear test is available with us, and these strips are available at a very cheap cost, and it is available everywhere. So these are simple strips with few markings on it. You can see here like 5, 10, 5, 10, 15, 20, 25, and these strips are dyed with some blue color. So whenever you put this strip on the lower eyelid uh, for a minute, then the wetting occurs and we need to read this wetting area. And generally it is we keep it for 60 seconds, and after 60 seconds we read it. Generally the normal values in dogs are like, if it's greater than 15 per minute, it is considered normal production for the tears. If it's between 11 to 14, it is early or subclinical cases. If it's between 6 to 10, then we consider that it is a mild cases. If it's less than 5, then it is a very severe cases. STT rating in cats is generally more than 9 per minute. But generally, like when we talk about the cats, the interpretation of this case, this shimmer test can be a little tricky, because that cats can control their reflex steering, and whenever they can control their reflex steering, then your reading may be false. So you have to interpret as a whole, and you have to look at the temperament of the cat also to interpret this as GT values. And what are the different? As I told you, basically this STT measures only the aqueous part of the tear film, right? So it is not measuring the mucin part. It's not measuring the lipid part. So this STT value is only measuring the aqueous part of the tear film. And sometimes there may be some deficiency problem in the mucin layer. Sometimes there may be problem in the lipid layers. So what are those causes? Sometimes there are disturbances of the tarsal or muban glands that may cause problem in the TFM. There may be inflammation of the mucocutaneous junction, which is referred to as the marginal blepharitis, which may also cause the dry eye. And Sometimes dogs with a generalized seborrhea may also produce abnormal meibomian lipids, so it may also cause the dry eye. And nowadays we have some advanced method of testing tear osmolarity. Few advanced instruments are available. Osmometer, we call it osmometer. Unfortunately, it's not available with me, but it's very common in a few practitioners in Europe and USA, and they are frequently using it. And basically, we measure the osmolarity of the tear film, and it also helps in assessing the tear film. And then we have this ocular surface analysis machine. This machine analyze all the three different layers of the tear film. It checks the lipid layer, it checks the aqueous layer, mucin layer, every component of the tear film, and it is a very good instrument to assess the tear film. It is known as ocular analysis instrument. Again, a very good instrument, but at the same time, very expensive instrument. Unfortunately, I'm not too sure how many of you have in India. Unfortunately, I do not have it, but it's very useful instrument, and this is how we use it. And tear film breakup time. Tear film breakup time test can also be used to assess overall quality of mucin. If there is any problem in the lipid layer, then we can use this tear film breakup time. And this is again a very simple test. What we do, we use the fluorescent dye, which we use for the examination of the corneal ulceration. If there's any breach in the corneal epithelium, then we use the fluorescent dye, and this fluorescent dye can be used for the TFBUT, tear film breakup time examination. And how we do it, we generally like keep the eyelids open and put few drops of fluorescent into it, and we do not allow the dogs to drink. And then we examine this fluorescent color with the help of slit lamp or with some magnification with the cobalt blue filter. And whenever we see any tear, here you can see any breakup of this film, and we notice the time we open the eyelid from this breakup of the tear film, and that time is known as tear film breakup time. And generally, when it is around 20, then it is considered a good time. When it is less than 20 or around 10, then we may think that there is some problem with the tear film or the lipid layer of the tear film. So this tear film breakup time is also very useful for the diagnosis of the tear film problems. And we also do few other tests, like as I told you, that facial palsy may also cause a problem. Ultimately, it will lead to KCS. So we generally check the facial nerves. So we also check the trigeminal nerves, and we are here checking the corneal sensitivity or the cranial nerve number 5. And these all tests were more useful in cases of dogs, not so in cases of cats. As I told you, STD is little difficult to interpret if you are not experienced. So may misinterpret in cases of cats. If you are very experienced, then it will be very easy for you. But what is the best lab test for the cats? There are many expensive tests are available. As I told you that mostly it is the infectious cause in cases of cats. When we talk about the dry eye, it is mostly the infectious cause. So which is the best lab test for the cats? Generally, what I do, rather than going for the test, I generally, or rather than going for the very expensive test, I will use the clinical sign and will do the treatment. Whatever money I am going to spend on the test, I will spend that money on the treatment, right? This is more or less true in cases of cats. So when we talk about the cats, generally I don't do any test. I generally rely on the clinical signs, and in the next few slides, I'll show you what type of signs you see in cases of cats, and how just with the clinical sign you can diagnose a condition of KCS in cats. So again, I have told you earlier also the canine keratoconjunctivitis tends to be non-infectious and feline keratoconjunctivitis tends to be infectious. Mostly it is infectious and in dogs mostly it is non-infectious. So cats. So in cases of cats, you may not get a clear-cut sign as you get in cases of dogs. So you have to correlate this condition with the clinical sign, right? It's bit difficult. It's very subtle signs in cases of cats. I'm showing you a few pictures of cats. Here you can see the discharge will be there. Here you can see mucopurulent discharge is there. Here you see cornea is very dull. It's not very transparent. Little opacity is there. And here you see no sign as such. Your cornea is looking very shine, bright, mild ulceration is there, and the mild discharge is there, right? So in cases of cats, the clinical signs are not very obvious as they are in cases of dogs. So you have to correlate the condition, you have to see the sign, and any recurrent condition is indicative of the KCS. And again, this is a very clear-cut sign. Here you see the cornea is very dull, ulcerated, it's not very transparent, and you see the discharge also. And what are the clinical findings in qualitative tear abnormalities? Whenever there is a there is problem in the aqueous part of the tear, we call it quantitative. And whenever there is a problem in the lipid part or the mucin part, we call it qualitative tear abnormalities. And generally with dogs with qualitative tear abnormalities, we see myogenitis, inflammation of the meibomian gland. Here you can see a lot of inflammation, and sometimes we see multiple chalasia also. Here you can see. So generally, whenever you see this type of sign, you may think of KCS. So what is your treatment goal? Now we know the clinical sign. Now we know how to diagnose the cases. Now we know the quantitative, qualitative cases. What should be the treatment for KCS? Generally, there are 3 or 4 treatment goals whenever we are dealing with the KCS. First, we have to identify and treat the underlying cause. If suppose it is a case of neurologic cases, and if we are treating it with the cyclosporin, then there are very high chances your eyes will not give any response. And if it is an infectious cause, and if we are not dealing with the infection, if we are not removing the infection, then there are very high chances we may get the failure. So first and foremost important thing is we need to identify and treat the underlying cause. What is causing the dry eye? Then at the same time we have to support it with we have to stimulate the tear production. We have to minimize the tear losses and maximize distribution of the tears. And we have to supplement tear films, and then we have to treat and prevent any secondary infection. Secondary bacterial infection is very common, and we need to check for that secondary bacterial infection, and we have to prevent that secondary bacterial infection. So these are our these 5 should be our primary treatment goals when we are dealing with the cases. Identify and treat the underlying cause, stimulate tear production, minimize tumor loss, and maximize distribution. We need to supplement tear film, and we have to treat and prevent secondary infection. So what is my initial treatment plan? So whenever I am taking a case of KCS, I always look for the cause first. And if I am not able to see any cause, I would assume that it is immune mediated, which is the most common cause of KCS in dogs. So generally, if it's immune mediated, I will start with the cyclosporin to 0.2% preparations are available in the ointment form. And nowadays we have a few drops also of the cyclosporin. So I will start my treatment with the cyclosporin twice a day. I will supplement it with the artificial tears, then topical antibiotic. If I see any sign of infection, definitely I would give the antibiotic drops and some lubricant drops once or twice a day. And generally, I give this treatment like 4 to 6 weeks. So this is how I start treating the KCS in dogs. Cyclosporin, as I told you, 0.2% ointment are available and drops are also available. And generally, I give one drop 2 to 3 times daily. Initially, I started with that. These are the product available in the market, cyclosporin. And how I monitor my treatment. I generally treat with cyclosporin for more than 2 weeks before the recheck. Before 15 days, I will not check the STT values. And after 2 weeks, I will call my patient back to my clinic, and then I will do the physical examination. If it is mitigated and if cyclosporin is working, what will happen? There will be higher STT readings, there will be decreased mucus, there will be increased comfort, and definitely I will wait for 2 to 4 weeks before giving up on 2%, 0.2% cyclosporin. Generally, we give up too early because it is a lifelong treatment. There will be patient, they will never, you won't be able to treat them. You have to give artificial tears. You have to supplement with other hyaluronic preparations or different electromagnetic drugs, and you have to give cyclosporin lifelong. So generally, I first check my recheck is after 15 days. Then at least I treat 2 to 4 weeks before concluding anything that it may not be an immune mediated disease or maybe something else. Cyclosporin failure, the first and foremost thing is that you are giving cyclosporin for 2 weeks, 3 weeks, 4 weeks, and you do not see any response, then again, you have to look for the cause. It may not be immune mediated disease, it may be because of some infection, maybe some because of neurogenic cases, and there can be many other problems which we have already discussed. So you have to look for the cause for it and then you have to treat it accordingly. If it is a case of neurogenic cases, then we have this pilocarpine drops available in the market. But whenever we use this pilocarpine drop on the eyes of a dog, it is little irritating. So what we do, we generally give this drop orally rather than topically. And how we give this drop orally? We generally start one drop per 10 kg body weight twice daily and gradually increase by one drop per day every 5 to 7 days until improvement is noted. And we have to be very particular with the dose. We cannot overdose it because it is little bitter and cause lot of problem, and it causes the systemic side effects also. So we have to be very particular with the pilocarpine drugs, because in severe cases we may get the vomiting, excessive salivation, urination, defecation. So we have to be very careful. And whenever you are seeing a neurogenic cases and whenever you see that cyclosporin is not working, and if you think that it may be a case of neurogenic cases, in cases of neurogenic cases, there is a typical finding. You have the dry eye that you have already examined, and beside the dry eye, you will see this mucopurulent discharge or the nasal discharge on the ipsilateral nose also. There will be dryness on the side of your dry eye. Suppose if you have the problem in the left side of the eye, then you'll see dry nose in the left side. And that is a very typical finding of the neurogenic cases. Always keep in mind, if you see uh, a dry nose, you look for the eye. If you examine the eye and you think that it may be a dry eye, first you have to check the nose. If you see it dry, then you are dealing with a neurogenic cases. It's a very typical find. You will not see this condition in any other condition. It's very typical of neurogenic cases. So how we use this pilocarpine? Generally, I use 1% pilocarpine for dogs who are less than 4 kg, 2% between 4 to 20 kg, 4% greater than 20 kg. One drop twice a day for 3 days, then increase one drop every 3 days. And I stop it when the systemic effects are in which we have already discussed, and then I restart at highest dose tolerated. So that is how we use the pilocarpine for neurogenic cases. If not neurogenic, then I may increase the cyclosporine concentration up to 2%. Then I may consider some allergens. I may use some coconut oil. I may add some potent corticosteroid like prednisolone is my drug. And at the same time, I will also consider adding tacrolimus, which I have already shown you. This tacrolimus. Tacrolimus is we use generally when we do not get any response from the cyclosporine. So tacrolimus is also a good choice when your cyclosporine is not responding. The first thing that you have to look for the cause, and again, if you are not able to look for the cause, you may consider using the tacrolimus drops. And you have to supplement it with some, electromimetic drugs. Nowadays, many electromimetic drugs are available in the market. You can use any of these drugs. My all-time favorite is sodium hyaluronic drops because generally it is very effective, and now it is we get it in the gel form also, which is very concentrated up to 1.2%, and it stays there for a very long time. It's very soothing for the eyes and very useful in cases of dry eye. So if you get hyaluronic acid preparation which is very concentrated like 1%, 1.2%, then it will be very useful. Generally what we are getting is like 0.1%, 0.2%. And I will also add corticosteroids, as we have already discussed that I will add corticosteroids also in my treatment plan when I'm dealing with the KCS. So sometimes again, everything is fine. Still, your cyclosporine is not. I mean, you are giving cyclosporine dose as recommended by the your books, textbooks. Everything is you are doing right, but still you are not getting the production. I mean, you are not getting the result. What could be the reason for it? Sometimes, few dogs are prone for it. Like their eyes are, they have the leg ophthalmos condition, and their eyes are exposed, and environmental exposure is more in such cases. So even when the production is normal, then also they get this type of condition, dry eye. So when if you do not know any reason, if you are not able to find any reason, you also have to consider your dog may have some exposure keratitis, so you have to treat it accordingly, right? And the cyclosporine failure might be more than aqueous deficiency. There are many cases where you will not get any responses from the cyclosporine. Few of them we have already discussed. And what more? Don't forget the mucin layer. Sometimes there is deficiency in the mucin layer, and that can also cause problems with the tear film stability. And we have already discussed how to diagnose and if there is any problem in the mucin layer, tear film breakup time. So whenever there is problem with the mucin layer, we generally give the moist heat. We express the Muven gland, and sometimes we use the topical petroleum also to soothe that Muven gland, and we do it say for 1 week or 2 week, and then again we re-examine the patient, and generally we get the good results. And nowadays we have some advanced instruments available with us, direct current plasma device. What actually it does, it has a dual mechanism of action, which it gives a continuous electric current to the your eyelids, to the gland, and it releases the plasma also. And the exact mechanism and how does it work, I do not know. But it is a very helpful instrument. Basically, it reduces the inflammation, it eliminates the bacteria, and improves the healing. And it is very special. I mean, it is very useful in the problems when you have problem in the lipid layer. If you have problem in the mucin layer, then this type of instrument are very useful. And here you can see, initially the animal was having a blepharitis here, and then after the treatment with the machine, you can see here much improvement. And now we'll talk a little bit on the dry eye in cats. As I told you, dry eye in cats is mostly infectious. When we talk about the dry eye in dogs, it generally it is non-infectious causes, but when we talk about the dry eye in cats, it is mostly infectious. And what are those conditions which causes the dry eye? In my practice or in my experience, there are two leading pathogens that causes dry eye in cats. First is your feline herpes virus, which we consider is the universal. Everywhere you go, you'll find this feline herpes virus. Even if the cat is not showing any sign of feline herpes virus, then also we assume that the cat is having this feline herpes. And the chlamydia is also very common. And these two are the leading causes for the cases in cats. And other minor causes are calcivirus, mycoplasma, not so important, but these two are very important: feline herpes virus and chlamydia virus. And just with the clinical signs, just with small clinical signs, you can differentiate whether the animal is suffering from feline herpes virus or is suffering from chlamydia. And if the animal is suffering from feline herpes virus, then you have to treat it differently. And if the animal is suffering from chlamydia, you have to treat it differently. Here you can see in cases of feline herpes virus, you will have the conjunctivitis. In both the cases, you will have the conjunctivitis. You will have the conjunctival ulcer in feline herpes virus, yes, but in chlamydia, you will not see the conjunctival ulceration. You will not see any corneal ulceration. If you see the sign of conjunctivitis, lot of discharge from the eyes, and if you see the corneal lesions, then you know it that you are dealing with the feline herpes virus. But if you see the conjunctivitis without the involvement of the uh, corneal lesions and conjunctival ulceration, then you know it that you are dealing with the chlamydia. So there will not be any corneal lesions in chlamydia, and there will not be any conjunctival ulceration in cases of chlamydia. But in cases of feline herpes virus, there will be corneal involvement. So that is how you can differentiate between feline herpes virus and chlamydia. So here you can see your cornea is there is an ulceration, so it is a case of herpes virus, and here you see conjunctivitis is also there. Here you see conjunctivitis, but there is no involvement of cornea, and in both the cases you will see the discharge. Here you can see discharge is there. Here again discharge is there. So just with the clinical sign, with the help of clinical sign, you can differentiate whether the animal is suffering from feline herpes virus or from the chlamydia. And these two are the major pathogens which are responsible for feline KCS. And how to treat it. I will not go too much details of it and how to do the antiviral therapy, but let me share a few things with you. A few common drugs which are very useful in human, like trifluridine, these drugs are also very useful in cases of cats, and they are found to be very effective, especially in for the feline herpes virus. But the only problem is that these drugs are very expensive, and these drugs are very irritating to the eyes. And more than that, they both drugs need to be given at least 5 times daily, and it is a problem when we are, I mean, putting drops on the eyes of cats that to 5 times in a day is very difficult, and ultimately it will lead to a lot of stress. And whenever the animal will have a lot of stress, then definitely uh, that viral infection will flare up. So it is not recommended in cats. As long as I mean, if you can give drops, you can put drops 5 times in a day. Your cat is cooperative, not getting any stress, then you can use it. Otherwise, you cannot use it. And this is the most effective drugs in cases of feline herpes virus, that is cidofovir. And this can be used in cases of feline herpes virus, cidofovir. Famciclovir again is very effective, and it can be used at the 90 milligram per kg body weight twice a day, and we have to use it orally. And this acyclovir creams are also available. We can use this also, and the tablets. And lysine can also be used. Lysine is also useful, especially in the viral infections in cases of cats. But here, do not give a cyclovir. It is not at all effective in cats. Well, cyclovir, it is nephrotoxic and hepatotoxic in cats. And avoid steroids. Basically, it may, activate the latent herpes virus infection. So we have to avoid the steroids in if you are dealing with the cases, then we have to avoid this steroids in cases of cats. So, what are the treatment guidelines? We have to continue treatment therapy at least 2 weeks after the signs of improvement, and you need to remember that you will not cure phalaenopsis, or your aim is to return to its latent state, right? Because there are very high chance that recurrence will occur. So you have to just tell the owner that there are chances that the recurrence will occur, and most important, you have to reduce the stress of the animal, because the stress will increase the problem, and it will, increase the viral multiplication. So we have to take care of that also. So what additional treatment for the tear film? We have to, you know, use few drugs, and generally prescribe hyaluronic acid based artificial tears, and that is my treatment of choice in most of the cases. I prefer it in dogs, I prefer it in cats also. So any hyaluronic acid preparation, here you can see 1.2%, which is very concentrated, and it is very useful, and it is a bad product only, and it is very useful. And when we talk about the chlamydia, we have to use the antibiotic, and generally we use the doxycycline, and sometimes we use the tetracycline also. Sometimes we use the tetracycline ointment for the chlamydia infection. And chlamydia, doxycycline and tetracycline, both are very effective in cases of chlamydia infection. And when we talk about the dry eye, there are a few surgical treatment also, like before the discovery of this cyclosporin, when the cyclosporin was not available, we used, personally, I haven't done this surgery so far, but in the initial days, people used to do this parotid duct transposition, and it is considered that the saliva and the tear film composition is more or less same, but the saliva is more salty than the tear film. But still, in very bad cases, we can use this parotid duct transposition. And nowadays, we have the cyclosporin implants also. Like if your dog is not cooperative and is not allowing any eye drops, you can put this cyclosporin implant in the subconjunctival tissue, and it will release the cyclosporin, say for a year or two, and then you have to re-examine it, and then you can use it again, or you can implant it again, and it is a very useful product. Uh, So thank you very much. It was all about the dry eye in dogs and cats. I'm sure that you must have learned through this presentation. And if you have any questions, you can ask me for those questions.
So the question is,
Mhm.
what is the role of N-acetyl carnosine in dry eye treatment?
N-acetylcarnosine was used earlier, but nowadays most of the preparation generally in India we do not have such preparation available with us, but maybe in some Europe open countries it is available with them, and definitely it helps in the help of dry eye. But personally nowadays, in the literature also and in the textbook also, there is very few mentioning of this drug. I do not have any personal experience of using this drug, and unfortunately, it is also not available with us.
Okay, so what is a treatment for corneal opacity?
Corneal opacity is a different condition. I mean, there can be many causes of corneal opacity. First, like the cases, you have to look for the causes of the corneal opacity. Once you know the cause of corneal opacity, then you can treat it. Like it can be because of some corneal ulceration, it can be because of some injury, it can be age related. I mean, there are multiple causes of the corneal opacity. So first, you have to look for the cause, then only you can treat it, because different problems have different drugs, to be used.
Right.
So definitely, once you know the cause, then you can treat it very easily.
So another question. Management of dry eyes in exophthalmic dogs.
Okay, especially like if we talk about the pugs or all the brachycephalic breeds, they generally have this exophthalmos. They have that leg ophthalmic condition. They are not able to, close the eyelids completely. For such dogs, when the eyes are healthy, we generally recommend the medial canthoplasty. Like in the very early age, suppose if the animal is like 6 month old, 7 month old, we can do this medial canthoplasty. And what actually we do, we basically reduce this cancer, and it is very useful once. And again, it's a very simple procedure. Hardly it will take like 10 to 15 minutes to do it. And but it's very useful in cases of bugs, because after the surgery, animal will be able to close the eye lids completely. The blinking will be proper, and just because the blinking will be proper, then the tears will spread evenly on the corneal surface. And definitely, in such cases, we should think of the medial canthoplasty.
Yeah, Falguni madam, the same question can go to a panelist also. By that time, Narendra sir, you can just stop sharing the screen. There will be a red button, sir. Red button. Stop screen share.
Okay.
Yeah, thank you, sir.
Mhm.
Falguni ma'am,
Next,
the same
next
question can go
question.
to the panelist.
Okay. Management of dry eye in exophthalmic dogs.
The same question again, exophthalmic dogs like pugs and all. So basically, there's hardly any lubrication in such dogs. When they come to us, we generally get a grade 3 or grade 4 dry eye. So basically, the clients wait for it before coming to us. It's advisable to come at a very earlier stage when we see a better lubrication. But in such cases, generally what I offer is a better lubrication with lubricant drops like carboxymethyl cellulose. Then what Sir said is like sodium hyaluronate, and first start with cyclosporin. If we don't get results within 2 weeks for cyclosporin, then I generally offer tacrolimus. And then if we don't get results, then we go for surgical conditions or something like that. What he described was a medial canthoplasty. It's a very good surgical procedure in brachycephalic breeds, Shih Tzus and all.
Right. What happens if a dry eye condition is not treated in time?
If the dry eye condition is not treated in time, it leads to keratinization basically on the complete cornea. And there's a black like film which appears on the cornea. It can lead to blindness. So it has to be treated in time for the pet not getting blind, basically.
For prevention of dry eye rather than it being happening first, how can we prevent dry eye condition?
Uh, Dry eye can be basically you go for an early ophthalmic checkup to your veterinarian. That's the first prime requisite. Second is you can start with lubricant eye drops for in breeds like pugs and Shih Tzus, because they are predominantly adapted to that kind of anatomy. So that's very important. So basically, lubricants can be started in the early stage, And then if something comes up, then the veterinarian can look up to it.
Ma'am, what about acyclovir topically? Does it help?
I have not much used it, acyclovir. So to comment about
Acyclovir is not at all useful in cases of cats.
Will there be any hyperplasia of conjunctiva in keratoconjunctivitis sicca?
Pardon?
Will there be any hyperplasia of conjunctiva in KCA?
Mm, yes, of course, there are chances. And maybe I'm not too sure, but yeah, there are chances that, I mean, there is possibility of hyperplasia. I have to also
Okay.
study about it actually.
What's the treatment for severe conjunctivitis in kittens?
Conjunctivitis in kittens. As I told you that
Yes.
keratoconjunctivitis or conjunctivitis, more or less, it is generally the infectious condition, right? And when we talk about the conjunctivitis also, and if you are talking about the kittens, then most probably it is the feline herpes virus, right? So you have to treat for the feline herpes virus. Once you treat for the feline herpes virus, then you'll get very good results. But as a supplement, you can start with the topical antibiotics. You can use some drugs which can reduce the viral load on the kitten, and you can you can use some electromimetic drugs also, some hyaluronic acid preparation also in the eye. It will definitely help, but it is mostly feline herpes in cases of kittens or cats.
Okay. Okay.
Sir, are there any mistakes that we can make while doing the Schirmer tear test that can, give us false results, maybe a higher number?
Pardon, I don't get it.
So while performing the STT test, when we do the
Okay,
tear
okay,
test,
okay.
are
Shimmer
there
tear
any
test.
specific locations that we have to put the strip?
Yes,
Can we
yes, yes, yes,
bilaterally or
yes.
unilaterally?
Actually, like normally, what we put this STT strip on the lower eyelid, and generally we keep it from medial to lateral part. We generally do not keep it on the medial part because we have this medial third eyelid here, and there are chances just because of the reflexes that third eyelid will displace that STT strip, and that tear pool. Generally what happens, that tears also get lost here, right, in the middle part. There will be tear pool because we have this puncta here. So there are very high chances if you put it here that you may get the false reading. So ideally we should put it from this middle part to lateral part. Right, that is the best place to put.
And so can we do it bilaterally, ma'am? Is it, will it give any false, reading?
Bilaterally, you mean to say putting two strips on one eye?
No. Together in
Okay.
both the
together
eyes.
into
Yes,
both the eyes.
of
Yes,
course, we
you
can do
can do
that.
that.
Yes, of course, we can do that.
That's not a problem.
Okay. I think questions are done. Yeah. Okay. All questions are done. Thank you so much, sir, for your presentation.
Thank you very much. Thank you very much.
Share a screen for the introduction.
Yeah. Mr. Nikhil has joined us. He is often called as India's eye drops man and Elon Musk of Indian pharma industry. He is a highly qualified research pharmacist from King's College London with various clinical pharmacy and formulation research accreditations to his name. He is a member of prestigious Royal Pharmaceutical Society in UK. with profound background in pharmaceutical research and unwavering commitment to innovation. Mr. Masurkar has propelled Entomeet Pharmaceuticals to become a prominent player in the healthcare industry indeed. His dedication to indigenous research, patient-centric solutions, and pioneering treatments reflects his commitment to advancing healthcare in both human and veterinary segments. Fur by Entoad in his latest venture, taking care of the furry friends by the help of technology-driven brands. In a sense, Nikhil Masurkar stands as a beacon of innovation and leadership in pharmaceutical industry, driving Entoad Pharmaceuticals to new heights of success and shaping the future of healthcare in India.
Thanks a lot, ma'am, for that very kind introduction. I'll just be sharing my screen. Just a minute, please. Right, so I hope you all can see the screen. So firstly, I'd like to thank all the doctors here for being part of this veterinary ophthalmology webinar. Just to give you a brief introduction of who we are and how we can contribute towards the veterinary field moving forward. So firstly, we started in 1977. It started with my great-grandmother on the left side. We belong to a family of doctors. My great-grandmother lost her husband, who was also a doctor at a very young age. So she started going to the forest and making these herbs and started formulating her own homemade medicines. Thereafter, she raised her children, and my grandfather on the right was inspired by her entrepreneurial spirit, and he became one of India's first few pharmacists. And he went into the pharmaceutical field. He became very popular in that field. He launched the popular paracetamol brand Crocin, and he was called as India's Crocin man. And then before he retired, he had a passion for specialty pharmaceuticals. So he set up Entoad Pharmaceuticals in 1977 with whatever money he had left post his retirement. So this is how we started. So today, with his and my great-grandmother's blessings and the blessings of the Almighty, we are one of the fastest growing top 5 specialty pharmaceutical companies in India. That's in the ophthal and ENT sector. In the top 5, we are the only family-run and family-owned business. We supply our medicines to almost 67 countries now. We have over 2,000 people in our team, and we are known in the industry for having one of the largest range, especially one of the largest ophthalmic range in India and also in the world. One of the reasons we've been around for 48 years is because we have an unmatched quality record, especially when it comes to sterile formulations. You'll see us in the news for all kinds of reasons. You'll see us for some of the innovations that we have done and some of the things that we are currently working on, like insulin eye drops, like indigenous molecules that we're working on. We'll also see a lot of news articles about us in terms of what we do. But more than all of that, I think we would prefer to be called the Tesla of the pharma industry because of our bold stand when it comes to innovation. After the pandemic, a lot of us realized that not just in manufacturing, but also in research, we need to be self-reliant. And that's why we started taking research very, very seriously. And now we are a fully research-driven pharma company. And moving forward, I think there is a lot of scope in this area as well. So this is something about our structure. So we have our company in India. We have a UK company, which has its own brands. Then we have our research firm as well. We have various divisions in our company, but the latest one that we've launched is obviously the veterinary division, which is called Fur by Entoad. And in this, we wanted to leverage all the experience we have in the specialty fields into the veterinary segment. And I'm sure that we have a long way to go, but I believe we are on the right track. So in terms of quality, we are known in the market for having a quality stamp when it comes to anything sterile. We've had one of the best quality records in the market. We have a very advanced QA lab. So every batch that is released in the market is double or sometimes even triple checked, depending on the susceptibility of that sterile formulation. In terms of manufacturing network, we have one of the largest manufacturing networks in India. They all have very good accreditations, right from US FDA approval to MHRA to WHO GMP. And when it comes to sterile manufacturing, it's an area that we've kind of mastered for the last 48 years. In terms of research, as I already said, it's not just the indigenous formulations that we're doing, but we also have a very active clinical trials program for human medicine. We are also got a lot of support from the Department of Pharmaceuticals in research, and that's an area that we're really focusing on. Um, I wouldn't. There was a little video on our R&D center that I wanted to share.
Sir, audio is not there.
The audio is not there. Okay. I'll just talk you through it. So this is our DSIR approved lab. And this is where a lot of our R&D is done. We have another lab as well, but this is the latest one that we inaugurated in January, where we have all the equipments that one would ask for when it comes to sterile ophthalmics, new product development, microbiology, MLT, sterility, R&D manufacturing as well. And if any doctors want to come and have a look at this center, it would be a pleasure to have you. We can also go through some of the work that we are doing, which is groundbreaking in India. We also have an AI lab here in this center, where we are going to be using generative AI to develop new formulations and new molecules, and that project has already started. It's the first of its kind in India. And we can also use it in the veterinary segment as well. So I'll just stop short of that. So basically, this is some of the formulation work that we've done. We've applied for several patents over the years. These are some of the ophthalmic formulations that we've developed, and all of them are commercialized as well, right from one of the first treatments for childhood myopia to intracameral injections to vitamin D containing eye drops as well. So there's a lot that's happened. These are some of the ongoing projects, the latest being the development of insulin eye drops for neurotropic keratitis. And there's a whole range of formulations. So once these are approved, it'll take a few years. They should be definitely the first in India, but also a few will be the first in the world. In terms of ENT, we also have developed quite a few formulations. We have ongoing projects as well. And then in the skincare segment, also, we have a topical neurotoxin that we've developed. And ongoing, there's a lot of innovative products, injection-free products that we are currently working on. And moving beyond that, we are also entering the biotech space to enter the new generation of therapies, such as stem cell-based therapies, gene-based therapies. We're starting a separate company altogether for this called Entomeet Biotech, and work on that has already started. So the infrastructure has always been upgraded. You'll see us, in Mumbai, but we're there in all parts of India. You'll see us in ophthalmic conferences. We have one of the largest field forces in ophthalmology in India. So wherever you go for an ophthalmic conference, you'll see Entomeet and its activities there. The quality systems, we adhere to some of the top quality systems that is required for India and for the world. This is just a picture we took last year, actually 2 years ago, of some of the products that we have. In fact, there are so many products. We have our own Wikipedia type page called Entopedia, where you can just put the generic molecule and the brand name and the product will come up. In terms of growth, in the top 5, we've always been one of the fastest growing and the fastest gain in market share as well. And we expect in about 2.5 years that we'll be on top of this table in the number 1 position in Opthal and ENT. Academically, we're very strong. We're always participating in academic events. In fact, this concept of ophthalmology in veterinary practice also is something that we were very keen on, and I'm sure that we will keep supporting that. In terms of, we also are involved in postgraduate support programs for ophthalmologists. There's a program called Netra Yatra as well. And hopefully in the future, we could also look at the veterinary field also. We have research collaborations with almost every top ophthalmic research center in India, right from Shankar Netralaya to Narayan Netralaya to RP Center, AIMS. We're also active in public education. We have our own YouTube channels, which have unbiased information on various issues of eye, ENT, and skin. And actually, we are going to be starting one for veterinary pet health as well, to educate pet parents on various aspects of eye care, ENT care, and fur and skin care as well. So that's something that we're currently working on. We also give back. So we are a very conscious pharma company. We have our own foundation called Matanand Welfare Foundation. We do various campaigns as part of this foundation, right from myopia awareness, and even in the area of pet health, we can also do campaigns and nationalize them. We also give internationally. When the Ukraine crisis started, we sent a lot of medicines to Ukraine in the war zone, and we were appreciated by the Ukrainian authorities for that. These are some of the key ophthalmic products in the human segment. So I won't go through this in too much detail, but I'll go straight to the veterinary products that we have. And it's just the start. There's a lot that's going to be coming. So here we have our the entire ophthalmic range of products. So we talked about sodium hyaluronate. We have a 0.18% sodium hyaluronate. We have dexamethasone. We have carboxymethyl cellulose plus N-acetyl carnosine. We have soft steroids like cloteprednol. We have antibiotics like tobramycin. We even have a sodium hyaluronate gel as well, which we feel would be quite useful for ocular surface conditions of cats and dogs. We also have the ear products as well. We have tacrolimus, we have cyclosporin, and the anti-glaucoma molecules as well. So it's the complete range. Obviously, there's a lot more that we're also looking at as well. I think one of the doctors mentioned acyclovir, and that is not suitable for cats. So we are also looking at ganciclovir ophthalmic gel as well, which we have in the human form. And if it is needed in the veterinary segment, we can also think of that. So there's a lot of new ideas that we could conceptualize and kind of bring into the market if there is therapeutic value. And finally, the reason why we are here today is because of our philosophy. So we have a very strong family-based culture and value system. Our model is based around the Red Lotus philosophy, which is basically that no matter how muddy the water around us gets, we always blossom, and we let our patients, including pet parents and animals, also blossom at the same time. And we believe we're here for a mission, and our karma allows us to fulfill our mission. So this philosophy has allowed us to constantly innovate and feel at one with everyone. And actually, that's probably one of the main reasons for why we are here today. So I'd like to thank everyone for giving me the time to speak. We are very active on social media as well, so you can always follow us, and it's fully academic. Not much commercial information is there. Thank you all. Thank you.
To conclude, I would like to thank Dr. Narendra Chauhan, sir, for such an insightful presentation and, of course, valuable information, sir. And I would also like to thank Dr. Madhura and Dr. Dudley for being present as panelists. I would like to thank all the participants who took the time of their day to be part of this presentation. Thank you.
Thank you very much. Thank you very much, Doctor.
Thank you, everyone. Thank you, doctors.
Rahul, we're offline now.